I've made a list of all the different ways that pain patients have been punished for an opioid epidemic they did not create. I was on the phone with a journalist last night, and I sent over this list to her. So shortly after the CDC published the guidelines, people with chronic intractable pain would be cut off their long-term opioid therapy overnight, no taper. They would be forced to choose between their pain medication or their benzodiazepine. They would be forced to drive hundreds, if not thousands of miles, trying to find any doctor who was willing to treat their pain. They would be forced on a highly addictive drug known as Suboxone, or they would be forced on gabapentin, antidepressants with Suboxone. They would be labeled as drug addicts, even though they weren't. They would be labeled as having opioid use disorder, even though they didn't. They would be forced to undergo painful steroid injections and other dangerous implanted devices, such as spinal stimulators, in order to receive a small daily amount of pain medication. They would be forced to pay close to $1,200 a month for pain medications. They would be discriminated against at any pharmacy they went to get their medication filled. They would be forced to pay for a psychological evaluation, even though they have no history of psychological problems. They would be documented as drug seekers, when in fact they were seeking pain relief. They would be told, turns out opioids don't work for pain. They would be told their pain could be managed with mindfulness, meditation. This mentality would eventually carry over into the acute setting, where people are now having spinal fusions and they're being sent home with no pain medication. People are being told that Tylenol and ibuprofen together is just as effective as an FDA-approved opioid. How much can one person endure? How much can people with chronic pain endure? How much can the elderly endure? How much can veterans who served our country, how much can they endure? How much more do people with pain have to be put through? Not treating pain with FDA opioids is a science experiment gone bad. We have a pain suicide list. We continue to work on bringing awareness to the millions of people who have been left to suffer.